Hi there and welcome. My name is Dr. Marlena Jabara, and I'm the proud founder of RadPodSquad. The RadPodSquad Fellowship offers an immersive learning experience tailored specifically to podiatric imaging. RadPodSquad combines comprehensive curricula, cutting-edge techniques, and on-demand access to training that will provide you with the new knowledge and skills that you need to boost your confidence in imaging and truly make a difference in treating your patients. Check us out today, radpodsquad.com. Hi there and welcome. My name is Dr. Marlena Jabara, and we'll be discussing MRI of the ankle, review of normal anatomy. Let's take a look. So let's take a look at some illustrations from the anterolateral side. And on this illustration, we can appreciate the rich network of retinacula and extensor retinaculum that support and restrain the extensor tendons. We can see a portion of the tibialis anterior, some of the extensor hallucis, the extensor digitorum, and even a portion of the peroneus tertius. We can appreciate behind this little guy here, which is the fibula and the lateral malleolus, the peroneus brevis and longus as they move down the line along the inferior perineal tubercle for the peroneus brevis to attach to the base of the fifth and the peroneus longus to go underneath a space called the cuboid tunnel. On this illustration, we can appreciate our Achilles insertion and our retrotendon and retrocalcaneal potential bursa. And furthermore, we can see bands of the plantar fascia with its muscle attaching to the plantar aspect of calcaneus. When we're thinking about the extensor tendons, we're talking about the tendons that are anterior. Those are your tibialis anterior, your extensor hallucis, and extensor digitorum tendons, and their actions are going to be for dorsiflexion. Moving laterally, we can appreciate the peroneus longus and brevis. Here we can take a deeper dive and understand that the brevis is superior to the longus at the level of the peroneal tubercle. The peroneal tubercle serves as a bone that will decussate and distribute the forces of the brevis and the longus. The longus is going to take a turn not only past the lateral malleolus, which is its first pulley, but then it's going to dive deep underneath the calcaneus, getting towards the base of the first metatarsal. Our peroneal tendons, furthermore, are restrained from moving off of the lateral malleolus by bands that keep it attached through the superior and inferior extensor retinacula. And furthermore, there are superior and inferior extensor retinacula that further restrain the extensor tendons from sliding anteriorly. We can see a portion of the Achilles tendon on this schematic. Moving down to the ligaments, we can appreciate the lateral malleolus, and moving from proximal to distal, we can see the tibiofibular anterior ligaments peeking out, the posterior tibiofibular ligaments. Moving to the tip of the lateral malleolus, we can appreciate the two bands of our ATFL. We are not appreciating the band of the arcuate fibers that join it to the calcaneofibular ligament, which is seen here. And we're seeing a piece of the superior perineal retinaculum that the peroneal tendons are restrained. We can furthermore see the inferior perineal retinaculum as the peroneal tendons move down the line, and these retinacula are very important for keeping our peroneal tendons secured to our calcaneus. Looking at the lateral tendons on a sample axial image, we can appreciate looking at a transaxial image at the tibia and fibular level. We're looking at the lateral retromalleolar groove. And this here is your peroneus brevis. It's either medial or anterior to the longus. And in this case, there's an accessory muscle. There's another tendon here and another muscle at the level of the joint line. And we can see this fluid is actually a volume average at the level of the tibio-talar joint line. Other structures that we can see on this representative axial image are some of the lower bands of the syndesmosis posteriorly and anteriorly. We can see our Achilles and a portion of our plantaris, and of course our medial flexor tendons, both the posterior tib, flexor dig, flexor hallucis. Looking at our extensor tendons, we see our tibialis anterior, extensor hallucis, and extensor digitorum. And we're going to review that several times throughout the course of this tutorial. And of course, the action of the peroneus brevis is powerful eversion. Let's move on and discuss lateral ligaments. First, let's just take a look at the schematic, looking at the tibia and fibula. That's our tibiofibular ligaments called the syndesmosis collectively, and the posterior tibiofibular or the posterior syndesmosis. Taking an axial representative slice through this region, we can see there are thin whispers of this anterior tibiofibular and posterior tibiofibular ligament joining our tibia and fibula. Looking at this great illustration of lateral ligamentous complex, we can appreciate now the lateral ligaments. Again, we can see our tibiofibular ligaments barely seen here on this lateral projection and the posterior tibiofibular ligaments. We can appreciate the ATFL, and here we can see some of those arcuate fibers that join the region of the ATFL to the calcaneofibular ligament. Furthermore, we can see a portion of our posterior talofibular ligament here. Dorsally, or looking at it from the back, we can see the lateral malleolus and the tibia. What we're seeing here is a portion of your interosseous membrane, a portion of the posterior syndesmosis, the inferior tibiofibular ligament, and at the lower tip of the lateral malleolus, we can appreciate the posterior talofibular ligament and also the calcaneofibular ligament seen here. Another view of the syndesmotic ligaments, this time anteriorly, we can appreciate the multiple bands of the anterior tibiofibular syndesmotic ligaments. Looking at this from the dorsal aspect, posteriorly, we can appreciate the thick posterior inferior tibiofibular sheet of ligaments and its relationship very closely to the interosseous membrane and ligament. Appreciating our lateral ligaments, an example here of the normal tibiofibular anterior syndesmosis seen here as a low signal band without water. There will be no elevated signal joining the distal tibia and fibula. We can appreciate a small portion of the posterior syndesmosis and, of course, our peroneus longus and brevis seen here with its muscle. Moving from proximal to distal, we can now appreciate portions of the lateral collateral ligament complex. That's our normal anterior talofibular ligament, and also bands of our normal posterior talofibular ligament. They're normal when you can actually see the low signal fibers, and there is no thickening greater than 2 millimeter. Moving down the line at lateral ligaments, we can appreciate the normal calcaneofibular ligament seen here from the tip of the lateral malleolus, diving deep to the region of the peroneal tendons. That's your calcaneofibular ligament. Seen in axial imaging, we can see the deep fiber of the calcaneofibular ligament deep to our peroneus longus and brevis at the lateral aspect of the calcaneus. Are you ready to take your podiatric imaging skills to new heights? Check us out at RadPodSquad.com. Explore our online learning community. And don't forget to like and subscribe to our YouTube channel for more enriching content.